Hello everybody, Dr. Mariana from Skin Talk here. Today I'm going to give you a lot of practical tips that you can do before and after our injectable procedures. So in general, anytime I have a needle in my hand, there's bruising that can potentially happen. So I have a special video about bruising prevention that I would recommend that you watch before you have any injectables. So in general, yes, bruising prevention with any of our injectables is a good idea. So let's talk about neuromodulators first. So before I inject neuromodulators like Botox or Dysport or Neusivia or Xeomin, there's really not a lot that you need to do in advance, but for afterwards, we want to make sure that the product that we inject stays in the muscles that we target. So we do ask you that you stay upright for 4 hours afterwards, so avoid bending down, so you're not going to go to the pool to have a swim, and then also for 10 minutes afterwards, just using the muscles that we have injected, so frown, smile, surprise, etc., just to make sure that once again the neuromodulator stays in our targeted muscle group. So the other thing then that I ask that if we inject upper half of the face, not to wear any hats or headbands that can potentially physically push that down. And we also want you to not rub or massage that area, and perhaps just avoid intense heat or very sweaty workouts for the 4 hours afterwards. So with our fillers, our dermal fillers, beforehand, there is actually a few things that you can do. I do recommend, if we are going to inject any area that you have cold sores, for instance, that you take your antiviral medications beforehand. And you also want to maybe just keep in mind about immunizations. Our general advice in my offices is that 2 weeks before and 2 weeks after our filler injections, that you not have any of your routine immunizations. And then I also do ask patients when they come into the office to come in without any makeup when we do fillers. The reason for that is I have to wonder, if we don't get all your makeup off and a little bit of that needle with makeup goes into your skin, if it potentially can compromise your fillers. So no makeup before you come in, and then also for afterwards as well. One of the recommendations that I have for fillers is to not wear makeup for 24 hours in the area that we've injected. So the other aftercare instructions with our fillers is, the principle is our fillers is moldable in that first few days, and we need to make sure that the integration happens with our own collagen, and in that period of time obviously don't want to have any extended pressure on the areas that we've injected. So for instance, when we inject cheek areas, I want you to try and sleep on your back so that we don't have any pressure on that area. I also do recommend any facial fillers, and especially mid-face area, that you avoid seeing the dentist for 2 weeks afterwards, just to make sure that those fillers are completely integrated in there. I also caution patients, if you wear Invisalign, we need to discuss that, especially if we're going to inject around your mouth area, and specifically fillers in the lips. So then other things, generally speaking, after fillers, also to avoid that intense heat, hot tubs, saunas, hot yoga, and also intense cold. I would not go skiing if it's really cold the day or two after your fillers. I also recommend for patients that I do fillers not to travel by air in a couple days afterwards. And it's more so to make sure that you are around, that I can take care of you in case of any potential complications. So then, looking at some other injectables, Valkyra that we use to inject under the chin area to dissolve fat. I want you to avoid anti-inflammatories afterwards, and it's because the Valkyra action needs that inflammation. So typically I just tell patients, put some ice on it, take some Tylenol if need to, but avoid the anti-inflammatories. And then for PRP or plasma rich platelets, where we harbor your own blood and inject the platelets for cell regeneration, I often tell patients we want your platelet counts in your blood to be optimal. So avoid really intense workouts for 48 hours prior to the PRP injections. So that gives you a few ideas about, the practical things that you can do before and after. When you do come into my office, we do give you lots of details, especially with the aftercare as well. So stay around for my shout out. Till next time. So my shout out today is about SkinCeuticals product called Phyto Gel. So this product is great if you have desensitized skin, so skin that's a little irritated. I use this especially after I've upped my retinol regime a little bit and my skin tends to be a little bit red and a little bit more peely, and it's great for post any of the procedures that can create a little bit of heat in your skin. So it cools, it reduces redness, and it hydrates like crazy. So in here is botanicals, there's a calming dipeptide, and lots of hyaluronic acids, and it's got this goopy green, fantastic smelling gel consistency that you leave on for about 10-15 minutes. I've even left it on overnight to really give my skin that nice drink that it needs every now and then. So I'll post some more details on my social media. Till next time, bye-bye.